Every year, Medicare updates its deductibles and copays under Original Medicare. Those changes directly impact your out-of-pocket responsibility under Original Medicare. Hi, I'm Larry Goist, owner of LMS Insurance Group, where we help seniors navigate the Medicare maze. So in today's short video, I'm telling you guys all about the changes to Original Medicare from 2022 to 2023. And really, we're going to talk about two main topics today. So I'm going to be telling you guys about your changes to your Part A benefits under Original Medicare. And then I'll tell you about your changes to your Part B benefits under Original Medicare. And that's all coming up next. So for starters, there are two main parts to Medicare, and that's your Part A and your Part B coverage. So let's start with Part A. So Part A of Medicare is your hospital coverage. So you're going to be covered under Part A when you're in a hospital, when you're in a skilled nursing facility, hospice, or home health care. You could think of Part A as when you're in a confined setting. And there is a deductible for Part A under Original Medicare. So please distinguish the difference. If you have a Medicare Advantage plan, if you have an HMO or a PPO, you're not playing by these rules. This video is for the people that have Original Medicare with a drug plan, or they have Original Medicare with a Medicare supplement and a drug plan. But this is not talking about the people that are on Medicare Advantage plans, as you guys play by a different set of rules. So under Part A, you do have a deductible to go to the hospital. And that deductible in 2022 was $1,556. So that deductible covers your first 60 days of hospitalization. What that means is if you're in the hospital for 3 days or you're in the hospital for 50 days, you're going to pay the exact same amount, $1,556. Now in 2023, that deductible went to $1,600. Now, you could be charged that deductible multiple times in the year under Part A. If you are discharged from the hospital and you're out of the hospital for 60 consecutive days and then you're readmitted, you are subject to the Part A deductible again. So in 2022, it was $1,556. 2023, it's going up to $1,600. Now that covers your first 60 days of hospitalization. Now, it's not very often where you're in the hospital more than 60 days, but there certainly are situations that arise where you can be. And once you hit day 61, that's when you have a copay at the hospital. So everything in the hospital that's done, your room, your board, the doctors that come and see you, any surgeries they do, the tests, it's all covered the first 60 days for that flat deductible. But then once you hit day 61, that's when you have a copay per day at the hospital under Original Medicare. So in 2022, your copay at the hospital from days 61 through days 90 was $389 per day. So it was $1,556 deductible, and then when you hit day 61, you're paying $389 per day. Now in 2023, it's a $1,600 deductible, and then you're paying $400 per day once you hit day 61. Now, if you happen to be in the hospital more than 90 days, now you're into your lifetime reserve days, and that's when they're going to start charging you an even larger copay. So days 91 and on, in 2022, the copay was $778 per day in the hospital. In 2023, that copay is going to $800 a day in the hospital after day 90. Now, the second major thing that's covered under your Part A benefit is skilled nursing care. So you are eligible for skilled nursing if you are hospitalized for 3 days or longer. And the whole purpose for skilled nursing, it's not for you to go live or for them to take care of you. It's for you to improve your health condition. So maybe you went to the hospital and had a hip surgery, right? And you're there for 3 or 4 days. Then they have to send you to skilled nursing to rehab your hip before they can send you home. Well, that is covered under your Part A benefit. And days 1 through 20 is a $0 copay for skilled nursing. It was that way in 2022. And it's also going to be that way in 2023. So days 1 through 20 at the nursing home, you don't pay anything. There's no copay. Then once you hit day 21 at a skilled nursing facility, that's when you have to start paying something for that benefit. So in 2022, days 21 through 100 at skilled nursing facility, you paid $194.50 a day through that benefit period. And in 2023, days 21 through 100 is going to be a $200 copay per day for skilled nursing. Now, I know those deductibles and the copays can seem kind of outrageous, but don't be worried, because if you have a Medicare supplement plan, if you have a Plan F, a Plan G, or a Plan N, all three of those plans literally pay 100% of those costs. So even though those are big numbers and they could be scary, if you have a Medigap plan on the side, you're not going to have to pay any of that because your Medicare supplement company pays it for you. So what about Part B of Medicare? What are the changes for 2023? Well, the most notable change is the monthly premium. So under Part A of Medicare, it is premium free. There's no monthly cost to carry your Part A benefit. But for Part B, there is a monthly premium. So in 2022, the Part B premium was $170.10 a month. And that premium is automatically withheld from your Social Security check every month. Now, if you're not on Social Security, then you're mailing a quarterly check into Medicare to pay that yourself. But generally, if you're already on Social Security, that's coming right off the top before you ever receive your benefit. So 2022, it was $170.10. And in 2023, it actually got lowered. It's $164.90 a month for Part B. Many reasons that got lowered, and I'll go into details on that in a separate video. But good news for Medicare beneficiaries, you're paying a little bit less this year for Part B of Medicare. So your monthly price in 2023 is $164.90 a month. But you also have a deductible under Part B of Medicare. So Part B covers things like your doctors, your outpatient testing, MRIs, CAT scans, durable medical equipment. So you're going to have a deductible the first time you use any of those services in a calendar year. And in 2022, the deductible was $233. In 2023, the deductible went down. It's $226. So what that means is you pay the first $226 of the year under Part B, and after you've met that obligation, then everything's billed at 80-20. Medicare pays 80% and you pay 20% after deductible. So the majority of people pay $164.90 for Part B of Medicare in 2023. But there are some outliers to that rule as well. So real high income earners are subject to what's called IRMA. So IRMA stands for Income Related Monthly Adjustment Amount. And it is for high income earners as they charge them more for Part B and for Part D of Medicare. And in 2022, the threshold for IRMA, which is when you're subject to IRMA, it means you're paying more for Part B or you're paying more for Part D. That threshold was $91,000 if you were single, or $182,000 of adjusted gross income if married and filed jointly. So in layman terms, if you made over $91,000 single, or you made over $182,000 married, you're not going to pay the $164 a month for Medicare. You're going to be pushed up to the next bracket. And those brackets go all the way up to people who make over $500,000 a year, or married that make over $750,000 a year. So it's 5 different brackets, and the more you make, the higher you go up in those brackets. There's going to be a link in the description below that shows those exact amounts, but what you need to know is that the change for 2023 is, under IRMA, they change it from $91,000 single to $97,000. So if you made under $97,000 in the year, you pay the standard premium. If you made $97,000 or more, you're going to be subject to IRMA. And for married couples that are filed jointly, that number's just doubled. It's $194,000 of taxable income. So anybody married filing jointly that did over $194,000 in adjusted gross income, you're going to be subject to IRMA. You're going to be hit up into another bracket, and you're going to pay more than the $164.90 premium. So all these changes are relatively easy to understand. They're just small adjustments in each category. And it's so important to not let these numbers scare you, because that's why they sell Medigap plans and Medicare supplements. Again, under the plan F, G, and N, almost all of these categories are paid for in full by your Medigap plan. And that's what we're here to help with at LMS Insurance Group. We're a full-service insurance agency that's licensed in multiple states across the U.S. We're able to shop different Medigap rates in your zip code, find you different Medicare Advantage plans, and find you the benefit that works best for your situation. Best part is, there's never a fee for our service. So if you guys need help picking out Medigap plans, going over the changes for 2023, please feel free to reach out to us using the information listed below. You could find us on our website, our YouTube channel, Facebook. Thank you guys so much for watching. I'm Larry Goist, owner of LMS Insurance Group. Hope this was helpful. If it was, give it a like or a share, and I'll talk to you next time. Thanks.